Well, good morning, everyone. Since the start of the pandemic, we've had workers' backs. We had their backs when Premier Ford negotiated with Prime Minister Trudeau a $1.1 billion fund for paid sick days last summer. We had their backs when we advocated to Ottawa for workers to have repeat access to the federal program, faster payments, and 20 paid sick days instead of 10. And we've got their backs again now. With the new variants of concern, workers in Ontario need more support now than ever before in our fight against this deadly virus. At the start of this pandemic, Ontario was the first to introduce unlimited job-protected leave so that nobody had to choose between their health and their job. And today, I'm pleased to introduce the Ontario COVID-19 Worker Income Protection Benefit. With the federal government indicating their openness to double payments through their program, we are stepping up to fill these gaps. We are the first in the country to double payments for the federal sick days program. With this new additional provincial funding, workers could now receive a total of $1,000 a week for 4 weeks. Make no mistake, Ontario workers now have access to the most generous sick pay program coast to coast. A persistent gap in the federal program is that workers must miss half of their work week to qualify. To fix this, our government will also lead the way by introducing the COVID-19 Putting Workers First Act. Through this bill, we are the only province in Canada to introduce paid sick days specific to COVID-19. If passed, all workers will soon have access to 3 paid sick days. This is more than the 1 day available to workers in Prince Edward Island and the 2 days available to workers in Quebec. This is a game changer, and this will save lives. Across the nation, nobody else offers an end-to-end protection program. The Ontario COVID-19 Income Protection Program doesn't just support workers who are sick, it helps our most vulnerable workers stay healthy. Our action today means that if a warehouse worker is told to self-isolate, she can do so without losing her paycheck. And if a grocery store clerk needs to take time off to get vaccinated, they can get paid while doing so. We've stressed from the beginning that anyone who's sick should stay home from work. But we know that for some people, it was hard to heed that advice because they couldn't afford to take time off work. If a scratchy throat or a simple sneeze meant they could lose a day's pay or more, some people were reluctant to stay home. This should never happen, and it ends now. We've also been clear since the start that we would not burden businesses during this very challenging time. We want to ensure businesses survive this pandemic and that workers have jobs to come back to. That is why, as part of our Ontario COVID-19 Worker Income Protection Benefit, employers will be reimbursed for what they pay out up to $200 a day for 3 days. To our frontline workers, building schools, hospitals, and homes, driving delivery vans, working the till at the local grocery store, we've got your backs. Please use these new benefits if you need to. To learn more, visit ontario.ca/COVID worker benefit or call 1-888-999-2248. All of us have a part to play in turning the corner on this devastating pandemic. For some of us, that simply means staying home when you need to. And to our small businesses and all employers, these proposals will make your workplaces safer and ensure you can continue to operate. As new variants flood into our country, nobody can let their guard down. Thank you, and I'll now turn things over to my colleague, Minister Bethlenfalvy.
Well, thank you, Monty, for those remarks. And good afternoon, everyone. Pleased to be here this afternoon. And as Monty said, our government's priority since the start of the pandemic has been clear: protecting people's health. Ontario is very proud of those working throughout this unprecedented time to keep essential parts of our economy and local communities open through the pandemic. They sacrifice so much at personal risk, often in difficult conditions. We certainly acknowledge that, like Ontario, the federal government has made beating COVID-19 their top priority. Our government values our close partnership with the federal government as we work together to protect and support the people of Ontario. And I would like to take this opportunity to congratulate Minister Freeland on the release of her first budget as Finance Minister last week, a truly historic budget. But we were disappointed that the 2021 federal budget provided no additional funding or direction to improve the Canada Recovery Sickness Benefit to protect our essential workers when they are ill or worried that they have COVID-19. Ontario is not alone. British Columbia has expressed similar concerns about the shortcomings of the federal government to enhance the Canada Recovery Sickness Benefit in their 2021 budget. That is why Ontario is stepping up to fill the gaps. As Minister McNaughton announced, this new provincial funding would allow eligible individuals to receive a total of $1,000 per week through the Canada Recovery Sickness Benefit Program if missing work because of COVID-19. Our government looks forward to securing Ottawa's commitment to administer the program with a top-up to all Ontario participants. We believe that this is the simplest and fastest way to increase program uptake and make this program more effective for those people who need this program the most. Premier Ford made a promise at the start of the pandemic that our government would do whatever it takes to protect the people of this province. That's a promise that our government continues to follow through on. Le Premier ministre Ford a promis au début de la pandémie que notre gouvernement ferait tout ce qu'il faut pour protéger la population de la province. C'est une promesse que notre gouvernement continue de tenir. These targeted measures announced today build on the unprecedented support our government has provided to protect people's health as we face the third wave of the pandemic. Our top priority is getting vaccines in arms, full stop. As we receive more vaccines from the federal government, we continue to rapidly expand our capacity to administer vaccines, focusing on the most vulnerable population. Nothing will prevent us from getting the job done. Nobody will be left behind. It has not been, and it won't be, a straight line to the finish line, but our government is committed to protecting and supporting the people of Ontario. And with the measures announced today, we look forward to working with our federal partners to ensure workers receive the care they need when and where they need it. Thank you, and I'll turn the podium back to Minister McNaughton.
Okay, we're going to go to the phone lines, and just a reminder, hit *1, and now I'd like to turn it over to the conference operator.
First question from Lorenda Redekop at CBC. Please go ahead.
Hi there. We're just receiving this release, so I'm just trying to go through this here. Is there something that the WSIB is going to be involved here? Could you elaborate on that?
Yeah, I'm really proud of what we're doing today to ensure that we have all workers' backs across the province. We're introducing a benefit to ensure workers are covered for 3 days. And I want to highlight just how flexible and how important this benefit is. This will help those workers who have to stay home and self-isolate if they are sick. If workers need to take a mental health day related to COVID-19. If you're a mom or a dad out there who has a son or a daughter who has symptoms and isn't feeling well, you can stay home as well and use one of these 3 days. Furthermore, we're really excited with the openness of the federal government to work together to top up payments for workers for $1,000 per week for 4 weeks. This truly is the most generous policy and program in the country. And we want to ensure that small businesses also have the opportunity to get through COVID-19 to ensure that they have a fighting chance to survive. We know that many small businesses and communities across the province have been hard hit. That's why we're going to reimburse those small businesses and all employers $200 a day for 3 days. And that program will be run and operated through the WSIB.
Follow-up. We've been hearing these calls for a provincial sick day program for months already from a number of different sources. Why did it take so long, and why this decision for 3 days when other professionals were saying that really, given that this is COVID-19 and the isolation period that's required, why 3 days and not more?
Well, look, we're leading Canada when it comes to protecting workers. We're bringing in protections for 3 paid sick days. The federal program runs for 4 weeks. We're there for workers through this entire pandemic. Let me go back to the very beginning, back last March, when we took action to bring in job-protected leave. We were the first province in the entire country to bring in job-protected leave for any worker who needs to stay home. If they're in self-isolation, if they're in quarantine, if you're a mom or a dad who has to stay home to look after a son or a daughter because of the disruption in the education system, you can't be fired for that. If you need to, just look after loved ones, your job is protected. Furthermore, our job-protected leave also ensure that people that get vaccinated can't be fired for that either. Then in the summer last year, we partnered with the Prime Minister to deliver $1.1 billion worth of paid sick days for workers here in Ontario and across Canada. Since that time, we knew there were issues with that federal program. That's why I work closely with Minister Qualtrough. Her department federally administers their recovery sickness benefit program, and we worked with them to ensure that they expanded that program from 2 weeks to 4 weeks of paid sick days off, to ensure that checks were delivered in workers' bank accounts between 3 and 5 days, and that's where we're at today, and to also ensure that workers could apply more than once to that federal program. So we were, working with them all the way along. And as the Minister of Finance alluded to, we were disappointed with the federal budget. We thought that they were going to come through, but clearly they didn't. We're stepping up today with a generous paid sick day program for workers in Ontario to ensure that we get through COVID-19 and workers stay home when they're sick.
Next question.
Next question from Jack Howan at Queen's Park Briefing. Please go ahead.
Hi there, Minister. I was wondering why is this temporary? Why does it expire in September? Will workers not still potentially need to stay home once the pandemic is over?
Look, I'm really excited about this program. This is going to get us through COVID-19 to ensure that we defeat this deadly virus as quickly as possible. I want to mention that this is retroactive. The 3 days that we're introducing very soon will be retroactive until April the 19th and will continue until September the 25th, which aligns with the federal government's sickness recovery benefit. But the goal of this, we made it very flexible, very generous, very open. The goal is to get Ontario and our families through COVID-19.
And I was wondering, did you consult with the science table specifically about this plan, and did they sign off on it?
We certainly had lots of advice from the medical community. This is something that we've heard loud and clear. Again, we were really disappointed in that federal budget. We know in their federal program, for example, according to the budget, there's about $700 million left in that bank account. They should have moved and moved in their budget to improve that program. But we're here for the workers in Ontario. We're going to get through this, and we want every worker out there, if they're unwell, feeling unwell, caring for a loved one, stay home and save lives.
Going to the next question.
Next question from Laura Stone at the Globe and Mail. Please go ahead.
Hi, Laura.
Hi, Minister. I guess I'm just wondering how you can kind of stand there and pat yourself on the back for this after a year of calls to be doing something about this. And I recognize you keep talking about the federal program, but really Ontario has faced calls from all sorts of people in the medical community, in the business world, in public health, mayors, to move on this sooner. So what changed? Was it just the incredible public pressure that your government has been feeling for the past few weeks?
Again, Laura, I mean, we moved decisively when COVID-19 hit the province. We brought in job-protected leave, so no one had to choose between their job and their health. And we advocated to the federal government to improve this program. I mean, take, for example, what BC's NDP Premier has said in the last week. They wanted a stronger response and better improvements to the federal program as well. It is a very simple program that they'd administer that would get checks into workers' bank accounts really quickly. In fact, 80% of those checks now are directly deposited into workers' bank accounts between 3 and 5 days. But we expected that there would have been something in that federal budget on April the 19th, and there wasn't. So I can assure you, we have worked day and night to ensure that workers are protected here in Ontario. We're leading Canada. Premier Ford is leading the country in ensuring that we have paid sick days and the supports for every worker that needs them. And I referenced, Laura, I mean, Prince Edward Island has 1 paid sick day. Quebec has 2. No other province. Ontario is the first to move to ensure that these supports are in place for workers.
And can you clarify, is there any application process for these 3 days, or will people just get access to this money right away without having to fill out a form or delay? And can you also clarify the part about topping up the federal government's program? That actually hasn't been agreed to yet, right? You're still pushing for that, but Ottawa hasn't said whether they'll allow it, so it's contingent on the federal government okaying this.
Yeah, I think there were a couple of questions there. I'll let Minister Bethlenfalvy respond regarding the federal program. And sorry, what was the first question?
Sorry, Minister. It was about whether there's a delay in actually getting the money, because that was one of the major concerns about the federal program. So can people just know that they're taking time off and will be getting paid for that time?
Absolutely. I mean, I eliminated the need for sick notes in Ontario last year. There are no sick notes required. This is a very flexible and generous 3 days that workers can take off with any issues related to COVID-19. If they're, in self-isolation and quarantine, if you have to stay home with a son or a daughter or another dependent, you're going to be paid for those days that you take off, up to 3 days. There's no forms, there's no applications. The employer will pay the worker, and the employer will be reimbursed through the province. And I'll let Minister Bethlenfalvy talk about the federal negotiations.
Yeah, thank you, Laura, for that question. The 20 paid sick days from the federal government, as you know, Premier Ford and the other premiers worked together with the federal government to come up with a national program. COVID is right across the country, and so having a national program made a lot of sense, and putting sufficient dollars in place. And the federal government responded when Monte McNaughton, our minister, and Minister Qualtrough worked together to fix to enhance the program, to go from 2 weeks to 4 weeks, to double it. So 20 paid sick days, to go to a faster and easier format to get money. As Monty said, 3 to 5 business days, 80% done digitally. These are the types of things that we work together on. But of course, we wanted more. We've been advocating for more, and you saw BC as well advocate for more. They filed their budget as we did, and protecting people's health, and the federal government on April 19th filed theirs, and there was no enhancement to the program. So we're going to continue to have that discussion with the federal government on many levels. The point is that their program exists. It's in place. It has the infrastructure. It is the quickest way to deliver those 20 paid sick days, and to double it. Ontario's offered to double that program. So that even means more for the hardworking families of Ontario. And, I'm an optimist and glass half full sort of person, so I am confident that Prime Minister Trudeau and Chrystia Freeland will do the right thing.
Okay, next question, and a reminder to hit *1 if you have a question.
Next question from Steve Paikin at TVO. Please go ahead.
Question for the Finance Minister. Can he tell us how much he is budgeting for this provision?
Well, thanks, Steve, for that question. We haven't put out a number. Of course, we don't know what the take-up's going to be, but as you know, and when I tabled our budget on March 24th, I said protecting people's health was our number one priority, that we would do whatever it takes to protect the people of Ontario. So again, we're stepping up in that regard. I've mentioned our disappointment that the federal program wasn't enhanced, but we've gone ahead. It's much like on the healthcare, the Canada Health Transfer. We've gone ahead and made historic investments in our healthcare system, our hospitals, our long-term care, mental health and addiction, as well as the staffing for that. And I'll remind everyone that as part of the budget, I tabled significant amounts of money for our COVID response, in addition to our base funding, almost $7 billion plus contingencies and reserves to be able to fund it. And finally, Steve, I'll be out. I'm out every quarter. We'll update the numbers as they come in. I have to do the first quarter by August 15th, so I'll be out in front of you again, and I'll be reporting out on the specific dollars. And this is a program that, on one hand, you hope no one gets COVID, so there isn't much take-up. But on the other hand, we want to incent people to get vaccinated, to get tested, to wait for their test results at home. If they've got concerns, as the minister has said, about how they're feeling, to incent them to isolate. And so this is the first mandatory COVID program in all of Canada. Thank you.
Can I get a follow-up here?
You do, sir.
Terrific. One of the things one hears on the QT is that there are concerns about bringing in a program like this because one never knows if members of the public will abuse it. And I wonder how concerned you are about that.
I'm not. I trust workers and families right across this province. This is a measure that we're bringing in until COVID-19 is defeated. We've aligned it with the federal program to end on September 25th. But if we need to extend it based on the COVID situation, we would do that. But again, to every worker and family out there, we're going to be with you every step of the way till we defeat COVID-19 once and for all.
Next question.
Next question from Robert Benzie at the Toronto Star. Please go ahead.
Thanks. This is for the Treasurer. I'm just wondering, I'm doing the calculations and talking to folks. It seems like this is going to cost more than $2 billion. Why wasn't this in the budget? You had a budget on just a little more than a month ago. Wouldn't it have been prudent to put something like this in the provincial budget instead of waiting and hoping that Chrystia Freeland would have something in her budget?
Well, there's a lot of prudence built into that budget, as you know, Rob, and as well. At that time, we were working with the federal government. The minister has been working with his counterpart, and I know the premier and other premiers across the country to see if we could make enhancements to that program. There's, as the minister said, significant dollars available in that program, and the awareness of that program. And we call on all our counterparts and across the province to promote that program. 20 paid sick days is a pretty good program. It's in place, and so rather than create a new one from scratch for that program, we've offered to double up the payments, the $500 a week, to make it $1,000 a week, and we think that's the right thing to do. So it's something that we've been very focused on in those conversations, and as I said before, I'm an optimist, and we'll see where those conversations go.
And following up, is there regret around the cabinet table that in October 2018, you got rid of 2 paid sick days that were mandated. That was Ontario law for about a year. And then when the Tories won the June 2018 election, they canceled that. Is there kind of a little bit of remorse that you removed that measure, because it might have alleviated the situation? We're now in the 411th day of the pandemic in Ontario.
Well, look, we're going to continue to stand with workers and their families in every community across Ontario. We're going to get through COVID-19 together. This is going to be a big help for workers out there. But furthermore, we've seen, especially in the last couple of weeks, pieces of legislation coming forward at Queen's Park for 10 days of paid sick days, 14 days of paid sick days. But those pieces of legislation squarely put the burden on the backs of small businesses. We have to give small businesses a fighting chance to survive COVID-19, to grow and prosper when we come through this. And more importantly, we need workers to have jobs to go back to when we get through this wave. So I'm proud of what we're doing today. We're there for workers across the province, and we're also helping small businesses grow and prosper and get through COVID-19.
I'd like to thank both the ministers. That was the last question. Thank you very much. And just a reminder, everyone out there,
thanks, everyone.
We are going to have the leader of the NDP, Andrea Horwath, up next, and then the leader of the Green Party up after her. Thank you very much.